Hey guys, hope you guys are doing well. Happy first week of the fall semester. I'm done with my first week of med Surg. So I can't believe it flew by, one, and two, it definitely has kicked my butt into getting back into school mode. Mainly because of the waking up, like I drive about 50 minutes to an hour, and I just have to start prioritizing school, which means that like cooking or doing stuff around the house will kind of have to take a backseat to it. But anyways, I just wanted to briefly talk to you guys about my week. So as you know, you have to take a dosage qualifying exam every semester once you take that class in the beginning of the nursing program. So I had class 4 days a week this week, Monday through Thursday. And Monday we have the big syllabus, or first day, orientation day, and then Tuesday at 7 in the morning was my dosage qualifying exam. This time around they asked for 20 dosage calculation questions, and they gave us an hour. In mental health, which was my 5-week summer course, it was, I believe, only 10 questions in only 20 minutes. And then first semester, the final exam for dosage calculations was 20 questions, and I think I had an hour. So I got 100%, which is great. It's funny because a lot of the first semester students are like, oh, I'm so nervous, I just hope the nervousness goes away. It goes away in terms of like just going to class, etc. You'll get more confident, and the more organized you feel, I guess the nervousness will kind of slowly decrease. But I mean, this is my second full semester, I guess, and I'm still nervous to take these exams. I think I will always be nervous to take these exams. And as much as I prepped, I mean, I did spend many hours just reviewing things just to make sure I'm not forgetting it. And I kind of, in the back of my mind, I'm like freaking out. I'm like, okay, make sure you know how to do this and drip rate and the conversions, so, and it's funny because I know the information. I've gotten, I think, 100s on the last two. So I mean, I really shouldn't have anything to worry about, but I do worry. I think that's just normal, but I use that to drive me to make sure that I actually am reviewing all I can before the actual exam. So I'm happy about that. That's over with. So for me, that's like the big hurdle you have to pass in the beginning of the semester. Like, I think if you fail that, you're like, that you fail the class. So that's why I think there's just so much pressure, and people could be like, it's only 10 questions or 20 questions, or it's basic math. But I just put a lot of, I guess, worry into it, knowing that if I fail, I'm out. So anyways, that's done with. And a lot of the questions were, you read a drug label, if you need to administer an X amount, how many tablets do you administer, and stuff like that. And then let's say if you had an IV solution and it was supposed to run over a certain amount of time, but for some reason you see that only a small amount has actually infused, what's the drip rate for you to either catch up, so you can complete the solution as it was initially set up. Let's see. So after that class, after the dosage exam, we had a really long diabetes lecture. And it's interesting that, like, how I say I read before the semester, I didn't get a chance to read the chronic illness chapter, which was the content that was discussed on the first day, and I didn't have a chance to finish all of the diabetes pages for the diabetes lecture. And that chapter was like, I think, over 50 pages. And so I just haven't been able to catch up, but that also brings me up a point that I'm going to talk about later regarding reading and a study technique that I am about to change. So anyways, the long lecture of diabetes, I think it's coming to life just hearing the instructor. I had issues with the note taking style or the note presentation style. I felt like it was a little over the place. The teacher was talking a little bit too fast. She was clicking through the slides pretty quickly, so I couldn't really write the blanks in. I had to keep looking at my French, paper. So again, everything is us, adapting to a new setting, new teacher, new learning, teaching style. So that's something that I'm hoping in the next few weeks I can, kind of catch up and just be better or more at ease during the actual lecture. Because in my mind, I'm like, oh my gosh, she's moving so fast. Did I miss that? What did she say? What was the actual example? Hold on, I need to go into the book, get the page number to reference. So there was just a lot of things going on. I did feel better today, and well, I think it was yesterday. I felt better towards the end of the class because I just kind of saw her teaching style. So today we had the skill check off by the instructors. Like I mentioned before, the foundation skills that you get checked off on are the NG tube, injection, sub-Q, and intramuscular, and inserting and removing a Foley catheter. So those were the 4, I believe, that we did in foundation. So we went and practiced with peers, and it's funny because you really do forget the little things. For example, when we were inserting an NG tube, some of us forgot kind of like the temporary dressing to adhere the NG tube and kind of in place before you like get the doctor's order for the x-ray and send the patient out, and then come back after it's confirmed that it's in the stomach. So we forgot. I'm like, is it 1 loop, 2 loops? So little things like that. Even the amount of gastric content that you aspirate, and then you check your pH level. Is it like 5 milliliters or 10 milliliters? And then someone forgot to say, well, do you put it back in? Do you not? So it's just really like the small things. So I'm really glad that at the beginning of this class they gave us the opportunity to study that. And we all looked it up and we discussed it and we asked questions. And the teachers were actually nice enough to answer those questions, although they are expecting us to already have known and mastered those skills. Let's see. So my point there is just practice, practice, practice. I feel like I have a little bit of practice to do, and by a little bit, a lot. And it's just remembering, I just want to get comfortable again, because like I said, the last time we did this was what, April? So, and then mental health was nothing really like nursing skills that were kind of used, so I'm a little rusty. But anyways, I was able to complete them all and demonstrate that I can do them all. So I guess I got it in a few days. But still, it doesn't hurt to keep practicing. The last 2 skills that were actually checked off today was cleaning a central line like dressing. And then we also did like IV, prepping an IV bag with a piggyback solution. And that was kind of it was kind of fun. I don't know, like I feel like it takes the skills like a step higher, like you have this central line in subclavian, let's say, and it reminded me, I mean, it forced us to again practice the sterile gloving technique, and that's hard for some people. Sometimes the gloves just don't fit well, etc. And it's just nerve-wracking because you're in front of the instructor and you're just going through all of these things and you just don't want to mess up. For me, we have a list that we can kind of like pick a slot, and I always do kind of the middle, so a lot of people can go before me and I have time to practice, and then people at the end can also do it. But it so happened that both of the lines, the IV prepping and the central line dressing lines, they called me back to back, so I had one instructor actually check me off on both of them back to back, which I actually liked it because the anticipation between getting skill 1 done and skill 2, so back to back worked out for me. I did do the central line dressing first, and I think that went really well. So let's see, I'm trying to think if there's anything that I would give tips on. Don't forget to put the mask on the patient first before you do anything, before you remove the old dressing. Make sure to inspect the current dressing that's on there. Look for the drainage, the color, whether the dressing is intact or not, the date, the time that it was last changed, etc. And those are findings that you want to document at the end of the procedure. So I did that. Oh, make sure if you're getting checked off, if you can bring an extra set of sterile gloves, that would be great. Oh, and this is another question or point. Initially, we view videos to teach us how to do some of these skills. And then we go in and talk to the instructor. And I guess, you know, everyone does it a little bit different. And for us, we were like, well, do we pick up the line and do we clean? There's a video that says, you know, when you're cleaning around it, obviously going from like inner outward, they end up picking up the line and cleaning, obviously, away. But that would mean that your sterile glove, your left or right hand, whichever one you use, would be contaminated. Therefore, that would mean that you would have to get the Tegaderm and apply it just with one hand. So I was just like, well, you know, what do? Do you just put a whole new set of sterile gloves on? So anyways, our instructors told us that we should just clean around or over it. Just do not pick up the line. Obviously, don't touch the patient with the other hand. And so that's what we ended up doing. And it was pretty, it was good. Once I got my sterile gloves on, you're kind of like smooth sailing. I will say that like our line was a little higher, like let's say if it was just here, so therefore like the patches like maybe the size of my hand on the mannequins, it was a little hard to get the Tegaderm dressing, the clear thing, to kind of like stick correctly, because it's not just one like flat surface like let's say on your chest. So but it is okay to like make sure that the entire dressing patch is over and stuck to the body. So that's that. Oh yeah, make sure you have your trash right next to you. You do not want to move away from the patient for any reason, especially when you're just starting the little scrubber. I don't know the real name for it. And like your old gloves and the old dressing, you know, you want it right under where you're working. Let's see, the IV prepping. That was actually kind of fun. That's kind of like a step forward to working with IVs, you know. And let's see, are there any tips that I have for that one? Let's see. So obviously you want to make sure that you're inspecting all of the supplies that you're using. Make sure that the bags are, you know, the color's right. There's no color, expiration date, etc. Once you actually like, the big deal that they were saying is like make sure you don't break the sterile of the actual spike from your like solution set tubing, your primary one, and then your bag, like not where it says set, not like add. And they have like these little tops or whatever, and it's interesting because I actually, like, some people actually hang it and pull and take, you know, the spike and actually insert it, but I hold my bag and I hold this, and apparently, and this is, it's interesting because you can practice it one way during lab and then you go in there for instructor checkup and totally different. I've never ever held both of them on the same hand, but apparently during my instructor checkup that's exactly what I did. I didn't contaminate both of those, I don't know what you want to call them, but I held them both. I don't know for what reason, but it was just interesting that I did that, but I didn't break any, you know, my sterile field or whatever, and so I was good. Once you put that there, make sure your clamps are off because you will get wet. And then once I actually hung the first bag, take the time to uncoil it. Like, you may be nervous or you want to just get this go over with, and you want to get to priming it and you just forget. Like, make sure you do that because it'll be easier to, once you kind of undo a little bit of the clamp to allow the fluid to flow through it, it will allow the, you know, less bubbles, and it'll just be easier to get it. And it may take a little while to get those bubbles out, and it's important for you to either verbalize or explain, like, you know, I'm tapping the tubing, so there's no bubbles, and it may take a while. And obviously once that's done, and don't forget to squeeze the chamber for some of the solution, fill it to maybe like a third, once that's done, I actually hung it up, and then I moved and grabbed my piggyback and the tubing, and I did the same thing. For that, same deal, don't forget to clean the port that connects the two. Also, don't forget to hang the IV solution lower than the piggyback, and make sure that you hold the bag down when you're retrograding it. And again, that's also another opportunity for you to make sure that the line is straight and the bubbles are not there anymore. And then close it off before you put it all up together. And I think that's about it, but it was fun, so I'm excited. And so that means, I think that's the only skills for the entire semester, which means we'll be doing hospital orientation Tuesday and actual patient interaction next Thursday. Also, we went through the DocuCare, comes from Lippincott, and it's just an EMR. So we kind of did like a 26-minute video orientation on how to use it. So I'm excited because my handwriting sucks. And so when you do patient documentation, I lose points. So now that we're required to do all our documentation in the EMR, I can type really fast and I won't get points off. So I'm super excited for that. Let's see. Let's talk about the study technique. So for first semester students, this is a time where you're literally, like, if you've gone to school and you think you know how nursing exams go and how to read text and how to do, you may be challenged, and by maybe you will be challenged. So it's very important for the beginning to try to read as much as you can, just to grasp the basic concept of things, and then to learn the nursing style questions, application questions, and then to be able to pull out the material from the text or the notes and change it up to what they're actually looking for. Like, there's just a lot that you do differently. It's not black and white. It's not like, oh, I read that on page 2 and that's exactly the answer for. No, there's a change in it. And I was talking to my group, and it's like it took us about a month to be able to feel like, oh, we get this. Oh, I now know why I'm reading this, or the significance of this, or how it could possibly show up on an exam. Or when I read the question, oh, I see that at least 2 of the questions has actual something to do with this, or it's relevant to it, or, you know. So it took us a good month. It was frustrating. It was really frustrating because you just thought you were dumb, or you thought, like, I cannot be a nurse. Apparently I'm failing everything. Like, the first few grades on, like, let's say module exams or quizzes were just horrible. Like, people were failing, and I'm probably one of them, because I knew it was just mindset was changing. So my suggestion, obviously, when you're preparing for the exams, look at the learning objectives. Make sure that you're able to answer those. If you can do them after each reading before class and then edit the answers while you're in class, that'll mean that you'll have pretty much all your objectives done before the exam, and you're just going over that. And you can quiz each other or have someone explain it and you explain it, just to make sure that you have the content. When it comes to the reading of the textbook, read the chapters if you can. Try to highlight some of the key terms, and then after class or after lecture, take your notes out and, you know, go through the notes and see where it is in the textbook. If there's any tables that are near it, go ahead and read that, because most likely that could be an example that will show up on one of the questions. So yeah, try to read as much as you can. Make sure you do your learning objectives. Make sure you study the notes, especially if they do like see page da 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 da. That means that most likely an example that will appear on the exam was listed or written in the textbook. So I told you guys to read the textbook, study your notes, do your learning objectives, quiz each other, and read the rationale behind all of the practice questions. If you can discuss it, whatever concept, that means you know it. The learning objectives is a great way to quiz you whether you know the material that will be on the exam. And for the beginning, it really is kind of, they're giving you what you need, and not a lot of people will do all of that, and that's how you end up failing. You know, if they say do the learning objectives, I mean, I remember there was one, maybe there was like 2 chapters that had like over 40 learning objectives. That's a lot of work. But so first semester, again, it kind of is like a weeding class, because you don't only just have one class, which is how it's been for the last in the summer and this semester for me. You have 3 or 4 classes, so there's work to be put in the beginning. So to say that learning and study techniques may change per different subjects. So right now, because med-surg, you know, you are learning these diseases, and you have these like the pathophysiology that you have to know about each one, you know, like how, you know, what is it, how does it affect the body, how do you look for it, you know, how does the patient manage it, you know, and all this stuff, medication. They suggested for us to do concept maps, and that's something new to me. So I ended up doing this already. As you can see, it's just a concept map. I got it from ATI, and you can pull that up, but this is, if you're not in med-surg, I don't think it'll be beneficial. I don't know, maybe it will. So that's something totally new. So I may actually do less rewriting my notes and just more studying off of this. I don't know. In terms of reading, I was told by another student that has taken the class before that I don't think that it would not be beneficial for me to read the entire chapter front to back, which is what what the teachers normally say, because there's just a lot of content. So this chapter, diabetes, because I just feel like I need more out of the actual book, I am reading that entire chapter, but that may change for what are we doing? Hematology next week. So I actually started reading after the lecture, and I'm getting things like 10 times better than I tried reading before the lecture. So maybe that's something that I'll do. Maybe I'll skim, try to find what's in the notes like I told you guys, and highlight those sections, and kind of like just skip read through the chapter, and then go back and read more in depth post the lecture. So I don't know, I'll let you guys know how that works. Again, please note, like, if you are following the stuff that I'm doing, it's different for everyone. Everyone learns differently, so feel free to try it and then change it up. For me, same deal. Like, what I've done so far to make it, I haven't made it that far, but that may need to change, and I think that's changing already. But that's that. Again, I just seem to talk and talk and talk. 23 minutes, Jesus. Okay, anyways, I think that's about it. I will, let me see if I have anything. Okay, so I believe, I think it's Bama Girl, if I got that wrong, I'm sorry. She had asked or was told that nurses at the hospital could be really mean. That's true. So let me just explain how it could look. It could be good morning, or it could be good morning, or good morning, how are you? You know, like you have those that don't care, those that are way too sleepy, they don't want to deal with you, those that are annoyed by you, and then you have that nurse or whoever that just can't wait to teach you, you know? Same for the physicians, like, you're like this big, you know? So just don't take it personal. Like, for me, obviously, I don't care who you were and what type of attitude you had or how your morning was going. I was always going to say good morning, whether you say good morning back or not, which is, you know, it's rude if you don't, but whatever. So you'll be working with a lot of different personalities. But I will say, if you do find a nurse that's willing to teach and, you know, it's like, oh, well, if you need anything, I'm here, just let me know. That's who you want to cling to. That's the person that you want to be like, hey, you know, have a few minutes before, is there anything I can do for you, or you can teach me, or, and then she'll be like, oh, well, actually, I need to go, give this med right now, or I need to go check a wound, you know, like, they'll ask you, like, oh, well, I have something to do in 20 minutes, do you want to meet me? I was like, yeah. So that's what you want. If you can talk and converse and just tell someone that you want to learn, especially that nurse that wants to teach. Hang with that person. They know that you have a list of a bajillion skills you need to work on while you're at the facility, so they'll be like, okay, well, let's see what you have on your sheet. Okay, I have this, so hang with me between these 2 hours and we can get all that done. That's what you want to do. And also make sure to treat these clinical assignments as kind of like an in-person long job interview. You never know if they want to hire you. Those that have asked me, I do have my CNA license. I did go for a interview at my last clinical site, but I wasn't extended the job, which at least tell me you don't want me, you know, don't leave me hanging. But it actually worked out for the better, really. I got overwhelmed with school or whatever, so it worked out perfectly, actually. But yeah, so look into places that you want to work. Find out what they need. Do you need a CNA license, or do you just need to be in a nursing program? Talk with them, and I think that's about it, guys. Hope you guys have a wonderful weekend. I'm super excited because I don't work Sunday night and I have Monday off, so I'm gonna find something to do. Oh, and before all of that, I will be what do you call that? I'm putting all of my key dates on my planner. Once everything's in there, I know when things are due, what is due, and like I feel like my brain next week would just function a lot better. I advise you guys who just started class, do that. You'll probably feel 10 times better and more prepared to take on this week 2. And I think that is it. Have a good one, you guys. Oh, keep talking. Please be nice. I would hate to disable commenting on the videos because I know the questions that you're asking, everyone has them, and I know you guys benefit from it, and I personally enjoy answering your questions. So I really just do appreciate if you guys could be respectful of each other. Again, a nurse, and this starts from the beginning, you are taught to be open-minded, non-judgmental. You have no idea who you will be treating. Therefore, please do that. Start practicing that now. But that is that, guys. If you have any questions, leave it in the comments below. Thanks, everyone. We're at 2,000 subscribers. I really, thank you. Anyways, that's it. Don't forget to comment, like, and subscribe, and share the videos, guys. Bye.